bit about healthcare in other countries, just as I said before, to see how we can use those as a model or an example for ourselves. As you guys may know or not know, that we're the only industrialized country that does not have a system of universal healthcare for all of our citizens. Although there are problems in each of the other countries' systems, overall their healthcare spending is lower, their quality is as good, if not better than ours, and for the most part, except for these few complaints, there's general public satisfaction with their system. They certainly wouldn't trade their system for ours. Britain has what they call the National Health Service. The government, that is the citizens with their taxes, now are the ones that are funding this healthcare system. The government runs it, it owns the hospitals, and it pays many of the providers, the specialists, and a lot of the services, dialysis and laboratories and things like that. Patients will sign up with a GP or a family practitioner, and their job is to keep those patients healthy. They have an organization in Britain called NICE, which stands for the National Institute for Health and Clinical Excellence. This is a government office that decides what gets covered. This system, which is completely socialized, is somewhat like our VA system, so we can kind of use that as an analogy, that the government pays for the VA system, and the employees of the VA system, the doctors and the hospitals, are all employees of the government. The other model, healthcare model, originally started in Germany with what they call the Bismarck model. France, Japan, and Switzerland all have variations of this one. In this country, insurance is, as in our country for the most part, acquired through employers. The employees pay part of their healthcare premiums, and their employer also pays for part of their premium. But everybody has to have insurance. It's mandated. The rates for the insurance are regulated, and the insurance companies are not for profit. So their insurance companies can't make money, they just have to break even. If somebody loses their job, then the government pays for their share. So people who lose their jobs don't lose their insurance. Payments to the hospital and the providers are negotiated by the insurance companies, or in some cases, as in Japan, by the government. And so everybody knows how much these countries, or how much their services, or how much they're going to get for each service. So an office visit costs this much, a gallbladder surgery costs this much, and they keep that the same no matter what. Canada is the other system that I want to talk about. It's the one that's the most familiar to us, and the one that you read the most about, saying, well, why can't we be like Canada? It's what we think of as, or call, a single payer system. It's a lot like our own Medicare. That is, the funding is through taxes, but the providers of the health care, that is the doctors and all of the people that provide health care, they're paid on a fee-for-service just like we are. Hospitals have a budget, and they apply to the government for their budget, and it pays for all medically necessary services, and everybody is covered. So the point is that all of these countries have health care that covers everybody. They spend significantly less than we do on health care. In the United States, 18% of our GDP goes to health care, and in these other countries, it's anywhere between 8 and 11%. In the United States, we spend $7,000 per capita. In France, they spend $3,000 per capita. In Canada, the cost of health care, 3 to 5% of that goes to the administration of health care, and in our country, 38% of it goes to the administration of health care. Now, there's a pretty big difference. So if you take 3% from 38%, that leaves you 35%, which would cover a lot of uninsured people, I think. In the other countries, the ones that don't have single payer, they have a lot of different insurance companies just like we do, but they're not for-profit insurance companies. They all share the same billing system, they have the same rates, and it's highly regulated. So they've been able to do that. In France and Germany, one of the things that they've done is they have a so-called smart card. And this smart card carries all of the billing information and their insurance company. So when they go to the doctor, they give the doctor the smart card. The doctor puts it in the computer, and the bill is generated, and the doctor gets paid the next week because of this particular system they have. Interesting also, as an aside, these smart cards also carry their entire medical record. Another way that they've regulated costs is by limiting malpractice. They regulate the fees. They regulate the cost of all of the drugs, or what they're willing to pay for drugs. Physician services are all regulated in these countries. And then lastly, one of the ways that they try to limit costs is by what some people would call rationing. I say rationing with quotes because it's not, that's the buzzword that we hear and that we fear. And because rationing is actually un-American. A better way, I think, to say it would be they have budgeting. In our country, we actually have rationing of a different kind, and the kind of rationing that we have is if you can't afford it, you don't get to have the services. Canada rations by limiting the number of specialists and the number of procedures and equipment that it offers. And so by doing that, what it does is it creates bottlenecks. Britain has this organization that I mentioned before called NICE, and NICE actually decides what gets covered. So they do make public their guidelines, so everybody knows what's covered, and their emphasis in that country is on prevention and community health. What we really have to think about is how we spend our healthcare money and the design of our healthcare system. Because you have to remember that the people who are spending these healthcare dollars are not the patients, but it's the healthcare providers. It's me. So if I, for example, have a patient that comes into my office with neck pain and they say, well, I want an MRI because my Aunt Susie had a tumor on her spinal cord, and I'm positive that I have a tumor on my spinal cord. So in this country, well, it's going to take me longer to convince them that they don't need it than it would be for me to just write MRI of the neck and send that patient off on their way. The patient wants one, and I want to make them happy. And if in fact they do have a tumor, a 1 out of a million chance, and I didn't order the MRI, well, I'm going to end up getting sued for that. The other difficulty in controlling costs is that we're all doing different things on different people at the same time. So one of my patients may be going to 5 or 6 other doctors, and we don't always communicate that well with each other. And so sometimes there's duplication of care, or sometimes one doctor writes a medication for this, and I write a medication for that, and they actually cause drug interactions. I'm not actually paid to coordinate care. I'm paid to see the patient. I have to see my 25 patients per day, or however many I need to see to kind of try to keep my office going. But I'm not paid to pick up the phone to call Dr. Rice or some other doctor that might be involved in the patient's care. Those things take time, and we're not paid for our time. We're paid to do things to people. There's been a lot of discussion recently, therefore, about different business models of healthcare. We live in this fee-for-service systems, that I just talked about, and a lot of people are talking about the Mayo Clinic or the Cleveland Clinic as being this great, model for healthcare. And in those institutions, the physicians there are paid on a salary, and rather than for doing all these different things to people. And there's a greater culture of trying to get people to work together to manage the care of a patient rather than each of us individually doing things for patient. I believe that we can look to other countries for inspiration and for some guidance in how to design a rational healthcare system that makes sense for Americans and that's based on our own cultures and values. In the face of a limited budget, we need some kind of rationing or budgeting of healthcare services to cut costs.
So rationing or budgeting of healthcare services to cut costs, A, would be strongly agree, down to E, strongly disagree.
All right. My second question is that Canadians often say that they don't mind waiting a little as long as everyone waits the same. Would you agree with that, or would you disagree with that?
Oh, very interesting.